COVID cases are on the decline. This week, California counties across the state were able to move into less restrictive tiers as more and more people are now being vaccinated. However, healthcare experts warn we're not out of it yet, and we all should still follow proper safety protocols. Sierra Health and the Center's Senior VP Kai-Ying Hang is with us to talk about where we're at in this pandemic and what still needs to be done. Hi, Kai-Ying.
Good morning, Aubrey.
So we know the public health measures we've taken have been working. What's been the impact so far?
That's right. Many thanks to so many of you. We're seeing some ray of hope, some optimism. COVID cases, case rates, and hospitalization have come down, enabling several counties to gradually and carefully reopen as they enter less restrictive color code tier. The accelerating distribution of vaccine is another ray of optimism as more and more Californians become vaccinated. Exciting about the governor's announcement yesterday about April 1st. California's 50 years old and older can get vaccinated, and by the middle of April, April 15th, 16 years old and older can get vaccinated. So we're really excited about that. We're also seeing a lot of conversations happening around equitable distribution of vaccine. The state's data-driven focus on equitable distribution of the vaccine, especially for those who are hardest hit, are all things that we can be proud of, and seeing the impact of our collective work.
Well, yeah, a lot of people are really getting excited about some of the vaccine news that is coming out about being available for everyone. Now, while the vaccine is here and that inoculation process is picking up, we keep hearing about possible threats of new variants.
That's right. That's right. The COVID-19 and its highly transmittable variant still remains a huge threat, even as we make progress. So this is why it's really important for us to continually to encourage each other to do what we call the 4 Ws. Wear your mask, wash your hands, watch your distance 6 feet apart, and then when it's your turn, please get vaccinated. And even if you've been vaccinated, please continue to mask up. So it's all about mask, mask, and mask, Aubrey.
Right, and we've been told to wear these masks for the last year, and the big majority of people have been heeding that call. But let's be honest, some people are still not wearing them correctly.
That's right, and it's really important. It's really important to properly wear this mask. Make sure it fits snugly on your face without gap, and that it has 2 to 3 cloth layer to filter the air well. If you feel space around the edges of your glass of your face behind your ear, or if your glass blocked, your mask probably isn't fitting well, and so appropriately adjust it so that it fits snugly. Our recommendation is, if you don't have multiple layer mask, it's okay to put on a surgical mask, one that has a nose bridge on the wire so that it fits snugly on your nose, and then cover it with a layer of cloth mask.
And you mentioned layers of masks, because we've recently heard some advice to actually double it up, to wear 2 masks.
That's right. It's really important to be able to do that as a way to prevent, further transmission and protect you from, possibly being exposed to COVID-19. And so it's important to layer it up when you're wearing your mask.
And should people still be wearing a mask even if they've been fully vaccinated?
We recommend, Aubrey, that people still should wear masks. There's so much research showing that mask protects us and helps stop the spread of COVID-19 even after being vaccinated. And so it's really important to continue to wear your mask in public even after receiving the vaccine.
And do you have a message for people who are just like, I don't know how much longer I can do the mask wearing? I'm having a hard time dealing a year in.
I would say right now is our best mean of protecting ourselves and our loved one and our communities. It's important to continue wearing masks in public even after you've received the vaccine, as transmission of the virus might still occur. The good news is that recent CDC guidelines says vaccinated people can and gather unmasked with indoor with other vaccinated individuals. If you've been vaccinated, you can interact with one other family of unvaccinated people without a mask if those individuals are low risk. But the more people you're congregating with, you're interacting with, particularly families, individuals who've not been vaccinated, just increases the risk of exposure.
That's
So
right.
mask up and really important.
All right, Kaying, important information, and you can find the latest pandemic related info online at covid19.ca.gov.
This interview involves commercial content. The products and services featured appear as paid advertising.